Yeah, I know it's frustrating. Thank you for that reminder.
Okay.
All right.
Good morning, everybody. Again, if I haven't met you all, my name is Michael Langer. I am the Deputy Director with the Division of Behavioral Health and Recovery within the Washington State Healthcare Authority. It is my privilege to chair this illustrious group. And I wanted to start off by just thanking you. I know we are about 6 months in now to when we first met. And wow, you know, working virtually, I don't think we've been able to have our relationships develop as deeply as we would if we were in person. There is quite a bit that's been going on to, excuse me, to get us to know one another a little bit better, and certainly a ton of work happening in the subcommittees. So I want to kick off today. We'll hear about subcommittee work and such, but just really wanted to set the tone today with a tone of appreciation for all of you in serving on the committee and putting extra time into those subcommittees. And then if there's a thanks on top of a thanks, it's for our committee chairs. They've really put forth, co-chairs, I should say. They have definitely put forth extra effort in planning for those meetings, facilitating and hosting them, and then reporting back and spending extra time with our staff. So with that, well, I see blue sky. I'm not sure the sun's out, but I see blue sky down here in South Thurston County. So this is a step forward. I will turn this back to Michelle and just really appreciate you all being on here. And for those that are have speaking roles today, thank you for stepping up as well. So Michelle, back to you for roll call.
All right, thanks so much. All right, first, as usual, I'd like to just cover the disclaimers here. So this meeting is being recorded and will be posted to the HCA website, webpage. The recording is open to public disclosure, so please do not disclose any private or confidential information. And then guidelines for public feedback. There will be designated time for public feedback in the last 5 to 20 minutes of the meeting. Each person will have 3 minutes to provide their feedback. Non-committee members will remain muted until it is time to share feedback. And if you are not able to have a turn in that, or you prefer to just email your feedback instead, any other feedback that's not presented in the meeting can be submitted to HCA ESB 5476@hca.wa.gov. All right, and now we'll go ahead and move into roll call. So, Michael Langer.
Present.
Thank you. Amber Leaders.
Good morning.
Good morning. Senator Dingra.
Good morning, everyone.
Senator Braun. Rep Davis.
Good morning.
Good morning. Thank you. Rep Griffey.
Good morning, everyone.
Good morning. Caleb Bantagreen.
Good morning.
Good morning. And I believe Victor Mendez is not able to make it. Kira Fisher. Alexi Orr.
Good morning.
Good morning, Alexi. Amber Daniel.
Yo, I'm here.
Good morning. Brandy Flood. Vicky Lowe. Chad Enright.
Good morning, I'm here.
Good morning, Chad. John Hayden.
Good morning.
Good morning. Marshall Glass.
Good morning.
Good morning. Sherry Candelario.
Good morning.
Good morning, Sherry. Hallie Virginal. Teresa Adkison.
Good morning, everyone.
Good morning, Teresa. Sarah Gillard.
Good morning.
Good morning, Sarah. Tank. Malika Lamont.
Present.
Good morning, Malika. Addie Adwell.
Hello, good morning.
Hi, Addie. Kevin Ballard.
Good morning.
Morning, Kevin. Hunter McKim.
Good morning.
Good morning. Kendall Simmons.
Good morning, everyone.
Good morning. Is Rep Taylor here?
Good morning, I'm here.
Good morning. And Rep Mossbrucker. All right, thank you, everyone. And I'll hand it back to Michael for the next agenda item.
Okay, thank you, Michelle, and thank you all again for being here. As we say at each meeting, please take the opportunity to have your voice heard at these meetings. We're pleased that you applied to be on, and we need to hear your voices as we walk through the agenda items. The next item we have up here is a little bit around processing the recommendations when they come forward. And I also, I'm not sure, Amber, if you were on earlier. I see you're on now. So Amber, leaders with the governor's office, welcome. I don't know that I saw you earlier, so thank you for being here. So this is around the first step on this in terms of processing.
Sorry, Michael. I think we are missing the committee norms and expectations piece.
Oh, okay, yeah. So let's go there then. Let's go to Senator Dingra, then I'll follow up after that.
Okay.
Thank you. And I'm just going to go ahead and read our committee norms and expectations as we do. Assume good, positive intent from everyone. Consider diversity, equity, inclusion, and tribal impacts in the work we're doing. Offer both and as opposed to either or. Show mutual respect. Be solution-focused. When identifying a barrier or systemic problem, offer ideas for potential solutions as well to inspire progress and creativity. Be fearless and willing to share innovative ideas or dissenting opinions with confidence that they will be heard. Make best efforts to attend all committee meetings. When attendance is impossible, inform the SURAC administrator. Language and terms. Use people-first language. Example, person experiencing homelessness rather than homeless person. Use the term substance use rather than substance abuse, which is stigmatizing. Avoid using the term addict, person-first language alternative, person with a substance use disorder. When someone forgets to use these terms, assume that the intent is still good and be gentle with reminders to use agreed upon language. Chat guidelines. If attendees have questions or comments that arise during the meeting, the chat function can be used to submit those. If you are an HCA program team member or other subject matter expert with direct knowledge that can answer someone's question, it is appropriate to provide a response in the chat. Questions and follow-up. Unanswered questions or other follow-up related to HCA programs will be addressed with internal HCA meetings in between SURAC meetings and communicated to SURAC members during the previous meeting recap portion of the agenda or within a follow-up summary document. Virtual environment. Type complex questions and ideas into the chat so we can pull those out later. Use raise hand function when someone else is speaking to indicate you would like to speak next. When multiple hands are up, wait for the discussion facilitator to call your name before speaking. Video is not required, although it is encouraged and helpful in facilitating conversation. Decision-making procedures and final plan recommendations. I believe this will take us to the next item Michael was talking about. Decision-making is based on general consensus. If, when a vote is needed to move a decision forward, each member has a single vote. For those who have designated alternatives, the alternative may submit a vote in the absence of the primary committee member. Committee members must be present at decision-making meetings in order to use their vote. All decisions will be submitted as recommendations to the Healthcare Authority for inclusion in the SURAC plan. If HCA determines any of the advisory committee's recommendations are not feasible to adopt and implement, then HCA will communicate that back to the committee. Recommendations that arise during committee meetings will be reviewed and processed internally by the Substance Use Recovery Service Plan team at HCA and categorized into the following: outside scope of committee objectives, not viable, with explanation, already being included in the plan or elsewhere implemented within state programs, topic for further committee discussion to sort out details. Use of delegates. When a committee member is absent, they can ask anyone of their choice to attend the meeting as a member of the public who can report back to the committee member. Such delegates will be able to provide input at the end of the meeting as part of public feedback, but will not have the same main discussion and voting privileges as the committee members. State legislator alternatives are members of the committee. Thank you.
Thank you, Senator. Appreciate you taking the time to go through our norms here this morning. Anything else you wanted to share with the group before we move on?
Thank you. I once again wanted to thank all of you for being here and doing this work. I know many of us feel this pressure to deliver because December's coming around and January the session starts. And I just wanted to say, I think one of the most important things that this group can come and help us with is really coming up with recommendations around drug possession cases. And the hope really is that those recommendations are based on data, they're based on best practices, they're based on the science as we know it, and that research is provided as part of the research to help. And I'll just say, when we're talking about treatment recovery outreach, it really is about taking a look at the entire spectrum of care that we currently provide and talking about, what is working, what isn't, what is missing, what are national and international best practices. And I'll just say, none of this needs to be perfect, because while there's a lot of pressure on this group to do this fantastic, perfect report, while that is the end product of this committee, that is the start for the legislative session. And there's a lot more work that is going to continue to happen, but the product of this group is what is going to start those conversations in the legislature, because at the end of the day, all of these recommendations are going to need the 25 votes in the Senate, 50 in the House, and the one from the governor to sign off on. So we still have a long ways to go, and I just want to thank all of you for being able to develop these recommendations that can be the starting point for our legislative session. So thank you.
Thank you, Senator. I appreciate your candor and direction and willingness to go a little deeper with this group in terms of expectations. We all want to do an A+ job, and we'll get there. It just may take it more than a few more weeks and months to get it there. So we will now transition into talking about how we may process through some of this work. Again, the subcommittees are looking at what enhancements can be put forth as ideas to the existing system. And if they haven't gotten to it yet, they will get to looking at the existing system and say, even within some of our more traditional workings, what kind of enhancements within those can happen. So enhancements to existing, as well as bringing forth, I guess, new ideas, new modalities, and new innovative approaches, or approaches that we are picking up, as the Senator said, from either across the country or around the globe. So lot of things to come forward to this larger group. This is the first item up is a relatively simple one, but an important one, because we have lots of views on this work. And I'll take a pause and say, if my video goes on and off, it's my connectivity. So I'm staying with you on the phone. I hope you can still hear me. The first decision I want us to make today, and we'll practice how we vote here a little bit, is whether or not, as subcommittee ideas come forth, again, consensus is the ideal, right? But if we can't get to consensus and we need to vote, whether or not a simple majority, meaning 51%, is good enough to pass the recommendation forward to be considered for the plan, or whether we want to go with more of a supermajority, something like, say, 70%. So of the group to support it, which gets us closer to consensus, but understanding there's still a minority point of view out there. So let me ask if there's questions on that. If not, I would like us to really take our hand voting go into the reaction area on your screen and you can kind of raise your hand. I'd like us to vote on whether we want to do the simple majority or more of a super majority in terms of moving things forward. Before we vote, I'm going to pause and see if there's any questions about that. Any questions about my question? I do not see any hands up for questions. And
Caleb has his
so
hand
I
up.
would ask,
Yeah.
I'm sorry, who was that?
Caleb's got his hand up. Caleb, do you want to go ahead?
Yeah, just my only minor question is whether there's a reason to think about 60% versus 70. 70 is a reasonably high threshold. I'm more familiar with 60, but I'm just curious sort of what I'm not been a member of that many sort of voting committees on types of recommendations. So I'm curious, any feedback on those thresholds.
Caleb, I know supermajority is used at 60% for, say, school district levies to pass, right? Or bonds, I guess at this point, levies are 51. I chose 70 as the option here just because we're striving for consensus, but I could really go with 60 or 70. I'd put 70 as the option. So do you have a thought on, Caleb, would you rather have it be at 60? Or do you care?
I'm just more familiar with it. I'm looking at Senator Dingra. He's probably very used to voting. I don't know if there's any thoughts on that. It's not a big deal to me, but I'm just more familiar with it.
Okay. Yeah, the only background is I chose 70 as supermajority. I can go a bit to 60 if the group would rather. Okay. Other comments? 60, Senator? I saw your thumbs up. Okay.
Sounds great. Thank you.
Okay. I see another
We also have
hand.
Senator Braun's hand up.
Yeah.
Yeah, I don't think it matters a whole lot. 60 is for bonds and both at the state level and the local level. 2/3 is the other one that's used constitutionally.
Right.
I don't know anybody that used 70 if you're trying to find something that lines up with something else. I don't think, frankly, as a person who suspects he's going to be in the minority on many decisions in this group, I don't think it makes any difference because I think you're going to have 60 or 70% either way on most decisions.
Okay. Other comments? Thank you. All right. So let's go with having our vote on simple majority, and then we'll stay consistent with the bonds at 60 and see if which way people want to go. So let's start. If you go into reactions, raise your hand if you would. Those that are on the committee for 51% or the simple majority, if you'd like it to be that way. And Michelle, if you can see them and count them, that would be awesome.
Mm-hmm. Oh, and if you're not a SURSAC member, please don't raise your hand or participate in this voting process right now. Yeah, just go ahead and keep your hand raised if you are a SURSAC member and your hand is up. Okay. Give a few more seconds for hands to go up. So you've got 2 people in favor of simple majority.
Okay. You say 2?
Mm-hmm. Yeah, I
Okay.
only see 2. Yeah.
Okay. Let's give folks a second. Take your hands down, and then I'll ask for the supermajority. Please put your hands up if you're in favor of the supermajority vote. Ding.
All right, definitely more than 2. 1. Let's
Okay.
see.
Okay. It's more than 2.
Yeah. Super majority.
Okay. For the record, we should have the number, but okay. Thank you. That was your biggest test of the day. I wish. So So thank you for going through that. Next up, we just wanted to talk a little bit about the, I'm going to bring this over in front of me so I'm not looking a different direction at you. The kinds of discussions that we're going to be having. So we have asked the subcommittees to dive into work, like it's already been stated, work around new models to bring forward, new things to try out. Hopefully things with evidence behind them, but if they don't have evidence behind them, we want to identify that too and say this is an innovative approach. But we also are going to provide to the committees the sort of list of existing services because they're growing. The legislature has certainly supported, and the governor's office has supported our work in this area over for a long time, but particularly in more recent years with new initiatives and things. So our list is relatively long, whether we're looking at outreach, engagement, treatment, or recovery support services. So we want to make sure that eyes get on those things and we don't forget something when in the end we come out with a path forward. We don't want to inadvertently leave off something. So, and then when they come forward, and we have a recommendation today out of the Recovery Support Services Committee, I believe, we'll want to look at that, ask questions. If there's clarification needed, ask the committee to provide that clarification, either in real time or if the group isn't all that comfortable and wants to have some more homework done, send it back to the committee. This is where this timing issue, folks, will start to come into play. How many back and forth the times do we have? But if we don't have, we'll look for consensus first of all. If we don't have that, then we'll go to the supermajority vote to have it considered. Now, when the consideration is it comes forward to be a plan item. You see there's a stipulation that Senator Dingler went over earlier in the bylaws here that follows the law, not bylaws, but our guiding principles and norms that follows the law that says, HCA, you guys need to take a look at this and make sure that it's lawful and all those kinds of things. So we'll do that. I don't anticipate many, if anything, coming through from this committee that HCA wouldn't say, hey, the committee has spoken, these are things we want to put forward. But we do want to do that cursory review. Yeah, and then again, this will go into a plan forward. We heard this morning already that out of the gate, we're going to want to focus in, and we'll talk about this in a little bit, about the possession law and things that follow behind that in terms of recommendations so that work can get done this fall and into session. And then these broader plan ideas, hopefully we'll have, most of the subcommittees believe they could have their new recommendations forward in time, but it's a furthering in terms of fleshing out the detail and adding in the existing and so forth that might take us beyond the December 1 time. Let me see. Yeah, I think those were the main points. I don't want to get us too far off the timing of the agenda here, but just wanted to give a reminder of the type of work that the committees are doing. They are also bringing in some experts outside of this group to sit on those committees. So if we're talking about treatment modalities or recovery support strategies and such, or data needs, that we're bringing in extra people, and this isn't easy sometimes because there's so many voices and such a strong interest that trying to get the ideas germinated. You guys sent some early ideas in those first couple of meetings we had. You said, here's things we want you to consider. So it's taken some prioritization and certainly some extra work to flesh those ideas out. So thank you. I'm going to pause so that I know I have 5 minutes until 9:30, which we need to transition at that point, just to make sure see if there's any questions around process. One other item I will say, I meant to say earlier, you all were chosen out of a lot of people who had interest to be part of the committee, and you come with your experience, and we really appreciate that experience. Sometimes in this work, as the committees are doing their work, there may be recommendations that fall behind the kind of work you do, and so you'll see some of that come up, and that's okay. We just want to make sure we have an abundance of transparency. So if recommendations come forth and that recommendation may impact your daily work, just say that. Just let us know. Just remind us. And that way there's no misunderstanding in terms of this committee's process and so forth. Now I'll stop and see any questions or comments related to the processing work that we have in front of us. Caleb, I see your hand up.
Good morning. I just want to let folks know I'm one of the co-chairs of the treatment subcommittee, that you have a list of recommendations, and that is not our complete list. We have more than 20 plus recommendations that you are not seeing, that we're still in the process of aligning, aggregating, trying to get the wording figured out. So I just want to let you know that we're in process on that. And I had hoped to have it ready and we just don't, but in terms of transparency, I want people to know we have a really long list of projects or proposals, which we're really excited about, but it's a lot. And that kind of makes sense given that it's treatment, which is our massive system we have in the state. And I've talked with Michael about this as well, but we're kind of interested in what's coming up so far is really high priority, interesting things are new ideas, and we're focusing on those. And what I'm hoping is that given all of the different treatment modalities, that we'll also get some support, and it sounds like we will, from HCA to almost create what I call the Blake filter, which is, those 14 items, A through N. If we're talking about an existing modality, how does that crosswalk with our existing rules and regs around that modality of care? Is that a low barrier model of care? Does it take a harm reduction approach? Does it provide service for folks who have substance use but not substance use disorders? So at least on my world, which is the treatment world, at least for the purposes of this group, just letting you know, we have a lot. Our intent is to be very transparent about that. We will get a revised list of recommendations out that are being proposed out to folks quickly. And we're also hoping for some help, given our incredible scope of work, to sort of take that Blake filter to each of these projects. And it is interesting, if you take those lists A through N, any of your things that you work on and think about, hey, does that really fit? How high a priority is that? And I know one of the considerations we're taking in our committee is, hey, the more things that this hits on those 14 items, that's probably going to be a higher priority item, because that's what the law is about. It says that the plan must consider these items in the manner in which they're implemented. So that's kind of the frame that we're taking. So just want to share that in terms of our committee's process.
Thank you, Caleb. And if maybe I'd throw a word of encouragement in there too. If it's not, could it? Right? So what would it look like to have lower barrier access to outpatient treatment, for example, or withdrawal management or residential? So thank you for that. I thought I saw another hand up. Malika, did you have your hand up? I don't see it up any longer.
I did have my hand up. I was just thinking in alignment with what Caleb was mentioning, how there's not necessarily as broad of representation. The draft that was attached to the on Friday that was sent out to everybody in this meeting, that is the draft plan, or had a lot of information about drug courts, for example, but it excluded funding or interventions that have been funded at different points in the SIM, the sequential intercept model. It was very focused on 3, but the state is funding a lot of different work currently at 0 and 1 with lead expansion, rest and jail alternatives, and none of those reports were included in that information distribution. So I just really, in alignment with what Caleb is saying, there's a lot of work currently happening that wasn't shared with the broader group. And I think that, when we're looking at consideration and like what the group is supposed to be considering, it's really good to, in the spirit of transparency, to have adequate information and accurate information shared with everybody. The state's making huge investments and communities are seeing a lot of positive impact. So just making sure that we're not just, there's so many people that don't make it into the treatment court system. And it's very much in alignment with the racial disparity data that was also shared in a number of those attached reports. And, since we're looking to address equity, it would seem like that is, these are things that we need to make sure that we're getting the full picture out there for the group members, and with enough time to be able to actually read it and consider it, because that came out at 1 o'clock on Friday. So just wanted to, before the meeting today. So just in alignment with Caleb's statements, I wanted to say that as well.
Thank you, Malika. And I guess my only response to that is, to my knowledge, we do not have a comprehensive list of everything at this point published. Michelle, I'm looking at you. So that is the desire to get there. Okay, I don't see any other hands. So I think at this time, I'm going to transition this over to Blake next, so we can further our conversation on the law around possession, criminal legal response to controlled substances. And you had all asked us to put together do some research and find some answers to some questions you had as you wanted to start thinking about how we're going to discuss this. And I know that was sent out, but you all met Blake at the last meeting. He has agreed to be our process facilitator for these meetings. And so, Blake, I'm going to turn it over to you and have you walk us through the next section. So thank you, everybody. Appreciate it. I'm sorry. I see Representative Meckendorf there. Yep.
Hi, thank you for having me here, Michael. I'm not a formal member of the committee. I just want to make sure and ask clarity. Am I able to ask questions or participate in the chat? Or would you prefer an email from those who are not part of the committee going to you and your team based on your presentations?
So thank you and welcome. For the committee members, yes, questions during this time. Non-committee members, we have public comment period at the end of the meeting, and anyone can ask a question there. You're also able to send in questions during the meeting or send them in after the meeting. So any of those options are available to you.
Thank you. I didn't hear that in the beginning. Thank you for walking through the protocol with me.
Sure. Thank you for being here. Okay. Blake.
All right. Good morning, folks. Blake Ellison with the Healthcare Authority. We are, as Michael said, we are going to continue our discussion on the criminal legal response to controlled substances. And Brianna, are you available to bring up our display, please? Would like to take some notes and make sure that we can all see those. Thank you, Brianna. And I want to introduce Aaron Young, our Office of Legal Affairs Section Manager, is here to answer any potential questions that we may have. Aaron, can you say hello real quick?
Good morning.
All right, thank you. All right, so on May 2nd, we, at the last meeting, the committee was asked what information they needed to formulate a response. What do we think about the criminal and legal response to controlled substances? We received that list from the meeting, and then on June 1st, we made available the information that we had, or available information that was emailed to the group and SURSAC members. And so today we would like to talk a little bit more about that. So you can see that Brianna's got the, we'll start with the language here of what we have for the law and see, and then continue our conversation from there. So you can see it, I'll go ahead and read it. Bullet 1 there is it unlawful for any person to knowingly possess a controlled substance unless the substance was obtained directly from or pursuant to a valid prescription or order of a practitioner while acting in the course of his or her professional practice or otherwise or expect as otherwise authorized by this chapter. Bullet 2, expect as provided in RCW 69.50.4014, any person who violates this section is guilty of a misdemeanor. And then bullet 3 there, the prosecutor is encouraged to divert cases under this section for assessment, treatment, and other services. And you see section 1.3, recommendations regarding the appropriate criminal legal system response, if any, to the possession of controlled substances. So you have the language there. And Michael, I'd like you to jump back in, if you wouldn't mind, about, we want to talk about what are our options moving forward here now that we see this language? What are our options moving forward?
Sure. So we could, as a body, we could say, you know, the way that the law is written now, we're going to hold pat. And my understanding means that in that case, the sunsetting would come and it would revert back from misdemeanor, I believe, to felony, if that would be the case, or something prior to Blake. We could say we want the sunset to go away, I guess, and so therefore just leave things as a misdemeanor as they are today. Or we could offer a third option, which is in response, what should the response be? Should it, you know, should we make sure that whatever could we, you know, decriminalize altogether and say our response is going to be that of only referral in for engagement and outreach and treatment and recovery. So there's lots of different ways to look at this. You know, certainly the residents of the state, certainly the leaders of the state are looking at this group that they put together to give them a sort of combined response of where we should go. We have a whole, a diverse group here that looks at this coming from different perspectives. And so what should the response be in the state of Washington? And as Senator Dingler mentioned earlier, what we put forth needs to gain the support of the House and Senate and the governor's office to get approved. If that doesn't happen, then my understanding is the sunset clause lives and things revert back here next year. So that's where I think we are. I think that also there'd be an interest in not only what should the law say in terms of the penalty, but then what are those services? What's going to be the best way and have the easiest access into services that we can say we have a better way. We can serve people from a health perspective rather than a criminal justice perspective. But we have to sort of articulate out what that looks like, and I think that's the charge of the group. So that's where I'm at. We have our legal representative here who can kind of keep me honest on that. And certainly we want some feedback from this group about whether the materials were sent out were helpful. What else might you want us to do from a staff perspective to share with you? And then going forward, we're going to need to look at some time together. And it's probably not going to be a half hour in these meetings. It's probably going to need, we've been talking about having a separate meeting just to focus on this topic. And I think if we set a subcommittee aside, everybody would be on it. So our thought is probably having this group go through a process together to come up with those recommendations. So I'll stop. And Blake, is that what you were looking for? Did I under or overstate that?
Yes. No, you're great. Thank you, Michael. Appreciate that. Malika, did you have your hand up? Do you have any comments? Or I know you put it down, but feel free.
So I was wondering, it seemed like this was not completely the way that this was recorded. Was this cut and pasted from the law? Because there's nothing in here about referral to community-based care, which like diversion from law enforcement to community-based care, which is what we've been building out a system across the state to do with the RNP program based on the LEAD model. So I'm just curious about that.
Yeah, I can respond to that. So this is the part from Section 9 that expires in July 2023 that is connected to how possession of controlled substances is, how that law has changed. So there's a lot. I mean, if we were to include all of the language that impacts the system, it would be a lot more than this. But we wanted to present that information as it's the piece that expires next year, and to provide some context for the discussion. But you're correct, and there's some comments in the chat as well that that build on that, Malika. So Lisa had said that this piece is missing the requirement of the police diversion to community-based care. And she also had commented that things revert back means returning to an unconstitutional felony. It won't be an enforceable felony without further legislative action. And so, but yeah, thank you for bringing that up. This isn't the full, I mean, there's much more of the law, the bill, the legislation besides just this piece, but we are highlighting this as the part that expires in July 2023. So I hope that helps for context.
But it's not accurate. That's my problem. Is it's like we're having a conversation without like all of the information. Like if people hadn't asked questions, we would be having like it just seems like we're doing this out of context actually. But there's other people with their hand up.
All right, thank you, Malika. Senator Ron.
Yeah, thanks. So I want to be clear on something. A couple things. One, we're mixing some terms. The diversion is a term used when prosecutors could not prosecute and instead get someone into treatment. That's no longer really the focus. A referral, I believe, is the term in the bill that allows law enforcement, if they find someone in the possession of drugs, they can say, essentially, they can say, there's some treatment down the street. Have a good day. I mean, different departments have incorporated different ways, but there's no arrest, there's no record keeping, there's no nothing. They just basically can encourage them to go to treatment, and they can have to think they do that 2 or 3 times, and they're struggling, frankly, with how to keep track of that because it's not a historic system. So I think we should be careful how we use these terms, and then revert back to normal. That's misleading also. We revert back. That does not mean we go back to. So right now we have a ruling from the state Supreme Court that says that the previous law was unconstitutional. That means when the sunset, if it occurs and there is no legislative action, we will go back to the Blake decision. There will be the possession of drugs will be completely legal in accordance with the state Supreme Court decision, and that. So we're revert back does not mean we go back to prior to the decision. Revert back means the decision still stands and there's been no legislative action. Right now it's a misdemeanor. If we don't do anything, it just becomes legal to do whatever you want. That's the nature of the bill. That's all. Thank you.
Thank you. Next up, we have Kevin.
Thank you. As a former law enforcement officer, I'd like to know, based on Senator Braun's comments, if there is legislative action and this continues to remain a misdemeanor, is there data being collected right now? And Senator Braun says, the data isn't really there. Is there data being collected that looks at the number of people who have been contacted by police, issued misdemeanors for possession, and failed to appear? Because failing to appear is yet another level of court interaction that is completely separate from what we're talking about here with substance abuse. We're trying to divert people and get them treatment, but as people fail to appear, they accumulate more and more culpability legally in the criminal system. And it's been my experience that it's those failures to appear that land them in confinement. So how's that being addressed?
Do you have any comments back for Kevin?
I'm not sure.
I'm not a lawyer, but I would like to say something about that. I would just like to say that as somebody that has worked closely with not only adults that are incarcerated in a social work setting, but also youth in Walla Walla, that most of the people I come in contact with are incarcerated on failure to appears or failure to complies, as they call them here, and not new charges. And I think that that's part of what LEAD is trying to address with case management services, is to keep people from those failure to comply charges by going to them and meeting them where they're at and keeping them out of that criminal justice loop. Because that's obviously not working. It's just locking people up for not showing up. And sometimes they can and sometimes they can't. But it's just an obvious unrealistic expectation. Because it's otherwise there wouldn't be so many people locked up for that. That's all I wanted to say about that.
All right, thank you. Appreciate that. And Rep Davis, had your hand up?
Yes, thank you. Just a suggestion. I realize we can't do it today, but I do think it would be a worthwhile exercise, perhaps to have a presentation to this group around what is happening with the Recovery Navigator program, aka the referral program, because law enforcement is not incorrect that they felt like they were sort of left empty-handed, with a mere referral card, or as Senator Braun said, down the street. We did, in fact, have more foresight than that at the legislature and had planned, this gigantic $45 million statewide investment in peer-driven, person-centered intensive case management services that is really just being stood up, of course, in Q2 of this year, statewide in every region. So a suggestion, perhaps for the next meeting, to have a presentation from maybe some of the BHASOs and maybe some of the actual contractors who are doing Recovery Navigator, to let people know what is happening and what will be happening, because I mentioned this in the last meeting, but it was never our intention to have it be nothing or to have it be a meaningless referral. It was actually supposed to be a really meaningful engagement, and it will be. It's just that is just now rolling out, and so I want to keep that top of mind for folks, so that we're not comparing to this falsehood of nothing, that we're actually comparing to what we built, which just started. And so understandably, nobody knows what that looks like yet, because it's just beginning. But if they could tell us what they're doing, and maybe some of the preliminary, even qualitative examples of what they're seeing on the ground, I think that would be very instructive.
All right, thank you. Michelle, did we make note about that presentation? The chance, potential for that?
I did. It's Brianna.
All right, thank you. Thank you, Brianna. Appreciate that. All right. Kevin, do you have your hand still up? Okay. Chad?
Yeah, I think I can answer Kevin's question in terms of people who are failing to appear to court under the current scheme. And I think I don't have data, but anecdotally, I think the answer is nobody, because prosecutors are not prosecuting these cases. I'm the prosecutor for Kitsap County. We don't have any of these cases. I don't think we've gotten any referred to us to charge as a misdemeanor. I've asked county prosecutors around the state if anybody else has. Obviously, I haven't talked to everybody, but nobody has told me that they're prosecuting these cases. I don't know if city attorneys are prosecuting these cases, but I think right now they're not getting into court. So, there's no hard data, but anecdotally, they're not getting into court, so nobody is missing court.
Thank you. Amber?
Okay, just first of all, I do want to let you guys know that I do work for RMP. I'm an outreach and engagement manager for the Recovery Navigator program in Walla Walla County. I'm not the program manager or anything. I don't make those decisions, but I am working firsthand with people in the LEAD program. And I also wanted to say that a lot of these, when we're talking about community-based care, what does that mean? what does community-based care mean? Because in my experience, it usually means that people are on probation and they're at more of a risk of these failure to complies and failure to appears, and it's just keeping them locked up. And so when we're talking about referrals to that kind of stuff, I mean, does that include the lead model, or is it just they have a PO? I mean, what does that actually mean?
All right. Senator Dingler?
Thank you. And I do appreciate the information that the prosecutor from Kitsap County provided. My question is slightly different on that, because while people may not be coming into the criminal justice system under drug possession cases, they're still coming in on criminal trespass, theft, a lot of other crimes that a lot of people associate with individuals who do have a substance use disorder. And so I think it'd be very helpful to get data on how the therapeutic courts are doing, mental health courts, drug courts, community courts, because they're still getting referrals. And so what I suspect is happening, because I don't have the data, is that even though they're not coming on drug possession cases, they're coming on other criminal charges that are connected to their drug consumption. And so I think it has to be a nuanced conversation, because it's the same population we're talking about. It's just the charge is different. So I wonder if we can ask our therapeutic courts for their numbers on who they're seeing and the services they're providing.
Thank you. We're going to go to Tank, and then we're going to talk a little bit about the chat here, and then we'll go back to the questions here. So Tank, go for it.
Hi, and thank you. So I just want to talk a little bit about the actual referrals, you know, and the diversion in terms of law enforcement. So one of the issues is that the referrals for services and assessment is so decentralized that when one police department makes a referral, or I would say when one police department applies for the lead program in terms of a person in their community, it's hard, I think, for each police department to keep track of that information, and how does other people track that information. So I think one of the central issues is the collection of that decentralized information, and how do we attack that information and collate it together to make sure that we have all the data. So I know at the beginning of this, I kind of jumbled this, but my thoughts are going like, I'm thinking about a million things right now. So, but being able to just collect that data to make sure that we're doing the best we can for our members in the community for these services. So just being able to tackle how do we get that decentralized information is, I believe, one of the toughest tasks. Thank you.
Thank you. Michelle, do you mind helping us out with the chat here? Any comments you see that are relevant? Thank you.
Yeah, definitely. All right, so comments from committee members have been from Caleb. Right now, the last year is not a fair test of the law, which is supposed to be diversion/referral to a care model that largely doesn't exist, even if we had the data, which we don't. It's diversion referral plus new low barrier and harm reduction access points and care, which has maybe 3% of the needed capacity currently. And then Hallie said, right now in Spokane, we received the Safety and Justice Challenge Grant. We're working to identify how to meet people as they are exiting the jail into homelessness. I can say this is very challenging to figure out. I don't know how pertinent this is to the conversation. We're identifying the challenges to navigate individuals directly out of the jail system. That initial contact prior to navigate before spending a night on the streets is crucial. Yep.
All right. Thank you. All All right, so we have talked again about the information that we had sent out, talked about some options moving forward, and I'll get to you here in a second, Amber, and talked about again other options, and now we want to talk about, is there any additional information, or ask you the question, excuse me, is there any additional information that you need as far as to make a recommendation? So I'll pause with that. We'll go to Amber, and then we'll start that discussion.
I just wanted to kind of like respond to Tank because nobody really did, and also because we have a way that we do that here in Walla Walla. I wanted to let you know that here in Walla Walla we have what's called an operations work group that meets every other week to talk about referrals, and it keeps us like connected. And the people in that operations work group are the prosecutors' offices of College Place and Walla Walla. We have lead referring officers that attend that work group. We have case managers. We have myself, the outreach and engagement manager. We also have a centralized like database that we use here for lead. We are forced to work very closely together. And I think that that's a good thing. And it's something that's been missing in a lot of areas where we don't have the, the criminal justice system and social workers working together, and clinical staff as well, and I think that that's something that we're doing pretty well here, at least beginning to. And I'm really grateful for that. But I think that it's really every person's responsibility to foster and build those connections within their communities as much as they possibly can. And I'm just really grateful I live in a place where we're willing to do that. That's all.
Well, that's great, and it's great to hear. So we have the same thing here in Whatcom County, all those groups. What I was really talking about is the people that are referred to other places and to other services other than LEAD. So I was just kind of wondering, how do we tie it all together?
Well, we have population health from Providence St. Mary's that is also part of that work group, and we also have comprehensive healthcare, comprehensive mental health. They do the mental health services here in town. So it's not just we have representatives from the mental health and from medical as well. So we get the information. And people have to sign a release of information when they do an intake into LEAD.
Thank you.
Thank you, Amber. Thank you. Appreciate that response. You've got some other Haley in the chat. Also, might want to chat with you about that. Caleb, are we back on additional information needed, or did you have another comment?
I just want to make sure that the conversation, I totally appreciate the legislators' urgent need to have this legal issue resolved next year and needing information to inform that. My point, though, just is to be clear, is that there's a complementary piece, that referral and diversion to something. So there's the possession standard, whether there's no possession cases, whether it's a misdemeanor, whether it's a felony, but just addressing that without addressing the complementary bit of services, it doesn't make sense. I mean, the whole law is predicated on them coming together. So I'll just share that on the treatment committee, the first task that we're working on, the first recommendation, is this idea around access to health hubs that are complementary community-based services for harm reduction and treatment and healthcare as a necessary complement, and just really trying to focus on this public health need with about 2,000 overdose deaths last year, which, just to remind people, that's the tip of the iceberg. That's like thinking about COVID and just thinking about the deaths and not about the people who have long COVID and trauma and anxiety that result from that. So there's an urgent public health need. We were talking about fentanyl 5 years ago. What was our plan going to be? We still haven't done that. So we have this law. I understand we have to respond to that, but there also is this complementary bit of, we are in a public health crisis, and we need to respond to that as well in a complementary way. So I promise you, Senators Denger and Braun, we will do more than just address this issue. We have to, in my opinion, address the complementary services component.
All right, thank you, Caleb. Appreciate that. Michael, did you have your hand up?
I think when we transition at some point, I misspoke out of the gate there. I wanted to make sure that we're really clear about the options again at some point, and maybe Aaron's better to do that than I was. So anyway, that was my only point when we're ready to get to that.
Yeah,
All right.
at that point too.
Is that you, Aaron?
No, it is. I was just speaking up real quick that I'm glad to chime in at that point to do that.
Okay. Actually, let's do that now because we've talked about we've talked about what we've sent out for information. Let's make sure we get those options moving forward clear. Thank you.
Sure, absolutely. And and from what I'm seeing here, there's really three things with this statute that we get the opportunity to, I think, recommend whether keep it and do something different with it. The one big part where the Blake decision came out last year really hinged on, I think, and there's other attorneys here that work in the criminal justice system that correct me, but under prong one, adding the word knowingly, that's really what the Blake decision came down to, is what other states have in place, what adds that mental culpability piece to it. So knowingly, had that been in there, I think the Blake decision never would have taken place, and we would have a statute that is still enforceable, right? And so now we have an opportunity to kind of do something a little bit different. So what Michael is saying, that one option, if it just reverts back, would kind of be that third option he presented, which is just where you get rid of it altogether, right? Because you would have a statute that's not enforceable at all. So the knowingly is just that one piece. So at a minimum, if we want to have a criminal statute, you need to at least add some sort of mental culpability. Right now, it's knowingly. Getting into the second parts of it, and then the next part of it is, what does that look like? Is that going to be a felony? Is that going to be misdemeanor? Traditionally, it's been a Class C felony. Right now, it looks like we're discussing whether it be a misdemeanor. And that third part, it says a prosecutor is encouraged to divert cases under this section for assessment, treatment, or other services. And so those are really the three things that this statute is doing that's compared differently. It adds knowingly, it makes it a misdemeanor, and then it recommends essentially that prosecutors send these things for services. And so I think kind of the decision point is this what we want? Do we want it to look a little bit different? And understand there's been some discussion here about how does this cross-talk with other statutes that exist for referral programs, or what does that look like on the bigger picture of availability of diversion programs or anything else. But I think when it comes to the very narrow questions of this particular statute, those are the things that I'm seeing. So I hope that addresses it. I see some hands up. I'll pause for the moment.
Aaron, I'm going to take a little privilege here and just ask for some clarification, since I feel like I misled earlier. If we do nothing, right? If what we recommend is no change, then the sunset ends in June, July of 23, and we revert back not to felony, but we revert back to unlawful law. So then we don't have a law. Is that accurate way of stating that? I just want to make sure that we're all clear about what happens if the law that's on the books now stands as it is. What happens? If you're responding, Aaron, you're on mute.
Sorry, I had to step away for a minute. Was that a question for me?
It was for Aaron. Aaron, are you still there? Aaron Young? Are you on mute?
Senator Dinger just commented in the chat that is correct. We go back to an unconstitutional law.
Thank you, Senator. Thank you. Okay. So if we don't do anything, we go back to the unconstitutional. And if we decide to stay as is and say we want the sunset to go away, we would keep it as a misdemeanor as it is now. Or we could represent something, or we could propose something entirely different, right? Okay.
All right, we're getting close to, thank you. Getting close to time on this subject. I want to go to Amber, then Malika, and then one more question to ask the group. So Amber, go ahead.
Okay, so I have two kind of points, I guess, that I just like people to either answer or consider. So currently under like the RCWs, as I understand it, it's not a crime to be a person with substance use disorder. Now, it's it used to be a long time ago. It used to be a crime for two people with substance use disorder to even be hanging out together. That's how people like organizations like Narcotics Anonymous got started. That's why the Anonymous is there. And then also, so why is something like possession of a controlled substance? I just want people to think, hey, this is like charging somebody for being a drug addict, a person with substance use disorder. If you're charging them with the possession, it's the same as charging them for being a person with substance use disorder. It's 2 and 2. And then also, I was just wondering, like, why there isn't anything about what do we do with these substances? Why do we have to charge people with something to try to somehow maybe keep the substances like out of the street? Like, do we have to make people criminals to keep this stuff off the street? I mean, is there no like middle ground? I don't know. Maybe I'm naive, but those are the two things that I wanted to say.
Thank you, Amber. Malika?
Well, to answer your question really quickly, Amber, just before I go into what else I was going to say, locking people up for like demonstrating the symptoms of substance use disorder doesn't keep drugs off the street. Interdiction doesn't work. Most law enforcement would say that. And continuing to lock people up for the symptoms of substance use disorder doesn't work either. And I think that raises the issue of why we need to really talk about a strong recommendation for putting LEAD at scale, because LEAD is not just a response program. It is a system. It's a runway to system change. It demonstrates how the system can operate differently in order to support people that experience substance use disorder or engage in public disorder or behaviors that are associated with public disorder as a result of their behavioral health issues, which substance use disorder is a behavioral health issue, and poverty. We can't just jump to services. And I think Amber talked about that earlier, that, the LEAD framework is needed to make all of this work, like these shifts. Just having no more, a different or no more simple possession. I'm sorry, I'm not feeling well today, but like having no more simple possession, a law about that doesn't address the issue. Like what we're all trying to talk about is addressing the broader issue. And if we can, but it's critical that we need to foster connection for those that need those connections to services and supports, because we've done the exact opposite of that with our criminal legal system response, or we have made it so conditional and high barrier for people to get access. Like, I don't know if people read the attached reports, but like the people that are even captured in some of the drug court data, specifically for my county, I live in Thurston County, it was empty. Like a lot of the, as far as like connection to service or what that looked like. And that's really discouraging to me as a person who has worked with people that experience, behavioral health issues and that have those people in my family. And I have my own, struggles. Like that is so concerning that we can't document, and knowing that so many people fall through the cracks. So I think that, we have to create a system, and there is a model that is internationally recognized. The LEAD model is internationally recognized for addressing recidivism, for connecting people to service. And we made a part of our 5476 response, like bringing it to scale could really create the changes that we are talking about. So I just feel like making a strong recommendation for that would be a positive thing to consider.
All right. Thank you, Malika. Now we need to go to Rep Griffey, and then again, one more question for the group, and then we'll move on to the next agenda item.
Well, thank you all. My name's Dan Griffey, professional firefighter by trade, and 35 years experience. And I think I wanted to answer some of the questions criminalizing addiction, that sort of thing. So I think it's important that we keep in perspective the first responders that actually are seeing people in crisis. We have used the criminal legal system to actually save lives. And I know that a lot of people here argue that point, that that doesn't happen, but we see somebody in significant crisis. We can't get in the county that I worked in for my entire career, we couldn't get a social worker for hours and hours and hours, sometimes days. We have used the criminal legal system to save lives. So we know that somebody is in a significant substance or mental health crisis, and highly likely, and I've seen it many times where we interact with them on several occasions in the same day, and at the end of the day, we find them, they have died. So if we're going to talk about all of this, we need to talk about what we're going to do about the individual in crisis. We've used the criminal legal system to get involved in their lives, not to criminalize their behavior, but to save them. So a hybrid approach of we can interact with them, we can get them in a crisis stabilization situation, and sometimes jail is crisis stabilization. And I know a lot of people here disagree with me on that, but I want to bring it back to perspective. I don't think it's criminalizing their substance abuse disorder. It's giving us legal tools to follow them and help them throughout their lives to make better decisions and save lives. And I think if we could all get to kind of that perspective, we could come up with a solution that uses the criminal legal system to get them into something. Booking, I think, is important because I believe in Maslow's hierarchy of needs that one needs to have self-actualization in their life. And I think even through the booking process and then the guidance that they get through the programs that we offer is important. And, you know, I want us to get away from the thought that we're criminalizing a disorder and more that we're trying to help, given the limited resource that all of us first responders have, save lives. That's what I have to say, and thank you so much.
All right, thank you. Okay, so we are pretty much at time for this particular item here. Great discussion. Last two questions, and we'll just leave you to send your responses, if you would, via email to this. Michelle, are you willing to take those to these questions here? And the questions are, is there any other information you need beyond what we've discussed and that you need from us? We have provided some information what we could. Of course, if it's available, we'll provide that. And then the second question, and we heard a little bit of this during the conversation, is that there any new ideas or alternative options besides the three that we went over that you can provide as alternates? So does that work for everybody? Michael, that work for you?
Yeah, I guess, Blake, just remind me one more time about the next step here. I thought we were going to see about the consideration of a special meeting. Is that what you were asking, or something different?
No, you can go ahead and discuss that now.
Okay. Again, there is a lot of passion, a lot of interest. This is one of our primary responsibilities. And so when we were thinking about this as a staff about how to get to some recommendation language, figure we're probably going to need more concentrated time with the group. And so I think the question is, do we want to take, if we take one of our meetings offline in terms of an opportunity to bring proposals from the subcommittees in on their program direction, that's going to delay that process. And so I see there's a couple options. You guys might see others. One is to call a special meeting and have a facilitated discussion to get us to some recommendations on this sooner than later, or take the July meeting with the understanding that that's going to push out some other recommendations. So either a special meeting or take the July meeting to further to basically just go deep for 2 or 3 hours on this topic and try to come up with some options to consider. So, and maybe there's a third thing out there. Maybe you're saying, yeah, we don't really want to do this until August or September. It gets really close at that point to the timetable. So my preference is to get there earlier if we can, but thoughts from the group on that? Okay, we can do our thumbs up here again, and if we want to get direction, how about go to your reactions and raise your hand again if you're open to a sort of planned out facilitated discussion about this as a separate meeting. Again, the other option is going to be take the July meeting. So how many would be in favor, how many committee members would be in favor of a special meeting to discuss options around the law proposal? And Michelle, that you count those up?
Yeah, so far 2, 3. 4, 5, 6, 7, 8.
Okay.
All right, so that's 7,
an
and I believe a 60% supermajority for this group today. There's 21 SURSAC members. I believe we need 13 to move forward with the idea.
Okay, so let me go the other direction then. We may not get 13 because we may not have everybody on here voting today, but let's get to the other option, which is to take the July meeting. I may change it a bit, say July or August, whichever one best fits in with, we feel like we have enough information, but to take one of the regular scheduled meetings and go ahead and spend that entire time on this topic. Let's have a raise of hands who's in favor of that.
All right, it looks like that has exceeded the, let's see, 1, 2, 3, 4, 5. 10 votes for that one.
10, okay.
Mm-hmm.
Why don't we plan on that then? I think the supermajority was more about how to get content into the plan. Yeah, this is really just a process question, really. So it looks like more would rather we take one of our regular meetings. So we will, if you're, we would ask for your entrustment in this. We'll look at the schedule and see if the July or August fits better in terms of having information available out to you. We'll try for July, but does that make sense? Are folks okay with that? We'll work it in. Okay. All right. I think, Blake, I'm ready to move if other people are.
All right. Thank you, Michael. Appreciate that. All right. Let's move on to the next agenda item. We have a recommendation review, tax incentives and housing vouchers for recovery housing services. So do we have somebody from the subcommittee to summarize that?
I will, Sherry Candelario. Before I get started, I want to share I own multiple recovery homes with my husband, Frank, in King County. And we are funded both by King County Drug Court and Department of Corrections. I also have a PhD from University of Washington Medical School, and my research was all about blocking opioids. So I may have an implicit bias towards medically assisted treatments. With that being said, we purchased our homes and created our program for 2 reasons. One, so MAT would be available, and the second reason that people would not be put out for relapse. And we did that in 2015. And we've watched the world join us in our belief system. And this was due to a personal experience with a family member. And so with that being said, there are many, many people with lived experiences who would be fantastic recovery home operators. And as the first accredited recovery homes in Washington State, we're looking at the Walker model. People are priced out of the real estate market. And this was not my idea. I facilitated the discussion. This was the idea of some of our folks who would love to operate recovery homes. And the discussion brought forth was, can we incentivize landlords by a tax break that is currently available to 501c3 recovery homes, the same tax break to allow them to open recovery homes and rent to operators. And the second piece of this kind of relates back to the Case House Foundation idea that we don't put people out for relapse, but many homes still do. That's been the custom for the last 50 years. And we understand the rationale behind it. You don't want to disrupt the home. So amongst the people discussing this were people from Oxford Homes, other people with faith-based homes. And the idea was, could a person who is an established recovery home operator establish a bed that is funded for somebody who is either awaiting treatment, so a very low barrier person, or somebody who's relapsed. And it's not the philosophy of these recovery home operators to keep somebody in the home who's under relapse. And so with that, I'll open it up for questions. And Amber Daniel is a member of my committee. And I think, Amber, you were the one who put forth the landlord idea. So anybody, any questions? I can't see the chat box and facilitate. So Michelle, if you'd like to put any chat questions to us, we'd like to hear everybody's ideas.
I also, I think, was the one that talked about the HUD-owned homes too, and trying to make something work with them. As well as the rural communities part. But I think that I would just like to say that here in Walla Walla, there is like a housing shortage, and there's not land that's cheap that you can get and that's close to services and everything where you could build out new recovery housing. People that here that have rental houses, they need to be incentivized to possibly rent or lease those to recovery housing operators. And if there's already a tax break in place for operators, but there's nothing to incentivize those owners, I don't see an increase in recovery housing happening around my area. And that's why I did suggest that. I know that it has to be a win-win, and there's no such thing as a free lunch, right? Unfortunately.
Well, I know even with us, we've only housed people who've been incarcerated or have been criminally charged for meth, heroin, and fentanyl offenses for 7 years. And we cannot rent a home, even with a good track record. So imagine being somebody who wants to put a home forward, who has life experience, somebody like Amber with the professional experience. And unfortunately, a lot of people who have are in recovery do not have the credit to go out and purchase homes. We used our retirement funds for down payments. And once those ran out, we found out we couldn't rent. So we think because of the King County, or actually the statewide housing market, being able to incentivize landlords is our best last hope to be able to get more recovery housing. And if somebody can facilitate, they've raised hands, that would be great.
You bet. I've got that. Rep Griffey, your hand up.
Sorry, forgot to take it down. Thank you.
Yeah, no worries. I thought that may be the case. So time, is it then time for discussion, Sherry?
It is time for a discussion, like everybody's.
Okay. All right, so let's go ahead and we can let's get some feedback to the group, if you have any. We do intend to vote on this here. All right, Haley.
My question is, were you able to talk with any landowners to see if this would incentivize them?
That's a great question. No, we have not.
I have.
Okay.
I have actually. I have a coworker here who's on the Housing Commission for Walla Walla, and she has rental properties, and she was talking about how you know, they would consider, you know, leasing one of their rental properties to recovery housing if there was an incentive. Absolutely. I mean, and that's just one person, but it is somebody that that knows how Walla Walla works and knows what has failed and knows what we need, you know. So is that, it's not a extensive data report, but does that help, Helly?
It does. I'm just thinking like how much I pay in taxes. So I just became a homeowner after a long time of struggle this last year, and property taxes are like $3,000 to $4,000 a year. Is that enough to incentivize a homeowner when they're thinking through oftentimes the lens of stigma, right? Because we stigmatified substance misuse to such an extent that they believe that people are going to come in and do all kinds of horrific things. And I also managed two low barrier recovery homes until they got sold this last year because property values went through the roof. So our rentals went on the market and we lost them. And that was while renting from someone who's in recovery, who had a significant personal investment in what we were doing, and we still lost the home. So I'm just wondering if this would be impactful or if it needs to be more than that.
What would you suggest?
Tax break would have slowed him in wanting to sell because he was, you know, he owned properties and was there to make money. So I wonder if it needs to go bigger than that. Although this, I think it's a good starting point, but I think it opens the door to, you know, I don't know how it is in the rest of the state, but Spokane is our rental properties. What I rented in 2019 for $1,100 is now $2,500 3 years later. So I'm just wondering, at least, yeah. So I'm thinking from my geographic region, if that would be enough to incentivize, and we all need them so badly. That was all I wanted to throw out there.
Oh, go ahead. I was going to say we did it at home and
we
had to
throw out there so that we can figure out, like, can we go bigger somehow?
All right. Thank you.
And Haley, I'm sorry I interrupted you, but we did rent one home and we had to offer a much higher rent to be allowed to use it as a recovery home. And so could we fund that with a voucher? I mean, that I love your go bigger because we're passionate about housing people.
It may also be helpful to frame, you know, looking at these recommendations, knowing that we're not limited in the number of recommendations that are made. So if something doesn't feel like it's enough, another recommendation can be made to expand on the idea, make it bigger, make it stronger, right? So if you view it in terms of, does this cause harm or help move things in the direction that you desire, that may be a helpful way to look at it as well. Malika.
I'm just curious why, I mean, no, I don't know if anybody has noticed Caleb's comment about, you know, financial benefit of people within this group, and also one of the issues that I had when this recommendation was being developed is that only one set of standards is being recognized. So the Walker standards, and I know that during the conversation, people asked exactly what those were, if we could have more information before they were included in the recommendation. And then there was another set of standards that was, and I can't find my notes where I had written down what that other set of standards were. Amber, I think, suggested them, but why we're only choosing one set of standards. And also, a lot of our conversation was about making sure that environments were inclusive of all people, because a lot of recovery housing options are pretty exclusive of people with certain lived experience, members of the LGBTQIA community, as well as when we speak of different ethnicities. So, and just in a cursory look at the Walker standards, I didn't see anything that was really, besides asking for demographic data, I didn't see anything that would actually promote and increase equity. And so, that was a lot of our conversation in that work group. And I don't feel like this recommendation really captures that. And it's concerning to me that we're attaching only one set of standards that it looks like HCA has put a lot of money behind. So I think that we should think about more inclusive standards as well as part of this recommendation specifically.
Thank you. Sherry?
I wanted to respond to that. Walker is the Washington affiliate of the National Alliance of Recovery Residences, and the standard is specifically about treating people ethically and with financial responsibility, and a large portion of the standard is safety and housing. And we do have a separate recommendation that we're working on right now on the LGBTQIA plus community. And so this one was specifically to bring forward about how do we get more housing. And our committee's hope is to have 8 to 10 recommendations that encompass all recovery services. And I agree with you, but before Walker, anything went as far as the sober home was concerned. And so we came together to really try to make sure people were treated ethically. And the other issue too, even though we are medically assisted treatment homes, the ones that we run, and I work with the justice system, Walker encompasses all types of housing. And that means people who are faith-based, people who are following, affiliated with churches. It's meant to be a huge umbrella with the sole purpose that one of the key elements of Walker is that everybody has a path to their own recovery. And thank you. I'll pause.
Thank you. Rep Griffey?
Yeah, thank you, everyone. So landlords right now, or property owners, are licking their wounds right now. For 2 years under COVID, they have had a lot of problems. Eviction moratoriums, well, I understand why they were put in place, put them in a severe loss situation. And so what we have to do is, when we're doing our calculations, whether incentives will work, we have to talk to them and ask them what needs to be fixed in the underlying landlord-tenant laws. There are a lot of fixes that needs to happen that would to encourage people to invest. If we're going to stay as prescriptive as we are in Washington State with landlord-tenant laws, there's going to be a lot less money available to be invested in these areas. This is a huge deal that we have to reach out to, I believe, to lots of landlord tenant groups and get to the bottom of it, because I think for them to invest right now in something that is very risky for them, they're going to have a lot more assurances on the underlying policies that we have in Washington before this would do almost any good. Thank you.
Thank you. Okay, more discussion, any more comments? Oh, Caleb, go ahead.
Thanks. I have sort of a two-part one. I'm really aware that recovery housing is desperately needed and that we need to have a broad continuum of recovery housing for folks who may be pursuing abstinence as a primary goal, and the many, if not majority, who achieve recovery without abstinence, perhaps the majority per John Cully's work. So I'm really excited about this. I don't know housing well. I don't know the financing well. I don't know the tax system well. I guess, so questions, two-part question. One is trying to understand within a recommendation, sort of the level of detail that's needed. And it seems like perhaps this might be a recommendation to, I'm trying to think about this as a two-step process. And I look at Michael with this, where there's a recommendation to say, this is interesting. We want to learn more and see how it would be fleshed out before we do a final recommendation to move forward. I personally don't know enough yet really to make a vote about some final recommendations. So I'm realizing across this and maybe other proposals as well, that we may need sort of this two-step process of interesting enough to pursue. Yeah, we'd like to learn more without it being a final recommendation. So that's one, park that. Then the second one I want to understand is, which is my comment, is that, you know, when I see tax incentives, I am smart enough to understand that's related to money and somebody either saving or making money. And so I do want to understand any potential personal financial interests of the SURSAC committee members. When, you know, who would gain from this? And is it a direct personal financial gain, you know, in an investment or for-profit manner? So that would be really helpful for me to know, also just to understand when I see that as our very first recommendation, that's kind of a surprise to me that it's that specific and financially motivated. I realize that money is what makes everything happen. I understand that, but I do want to understand that because unlike all of my work at the UW, and all of my federal committee work, we haven't had a financial interest, conflict of interest document that we've had to sign ever. So I would appreciate two very different comments. One is, what's our process? Sort of, is it maybe a two-process vote? And the second is just to understand any potential conflicts. Thank you.
Okay, I think that would be directed at us, me, because we own 6 homes. And actually, we don't take a profit from our homes. We're a nonprofit. And the other piece of it, in order to have our homes work appropriately, we have staff. So we have house leads that are compensated. We, this weekend, hired on a former drug court resident who graduated, who is now working with LEAD, who's going to work with our people to help them on next step housing. And we're not just housing people in recovery. We also have people who are at high risk for COVID from the federal prison system in 2020 who have nowhere to go. So our youngest person is 18, our oldest is 76. And so the financial incentive for us is, yes, we do own the real estate, but there's no gain for it because the vouchers from Department of Corrections are $700 per person. And unless you want to put a lot of people in a house, which we don't, nobody becomes wealthy on recovery housing. And we are actually out of King County. We're not purchasing any more homes. We're now priced out. So this is really directed towards people who want to lease a home in the future. For example, many of our people who don't have the credit to buy a home. I mean, that's basically it. So, and I totally agree with you on total transparency. When we were waving the flag of medically assisted treatment in 2015, everybody thought we were wrong. And, you know, you always have to be forthright. And the financial incentive really is to get the landlord to provide housing. One of the issues that we have found, because we go in nice neighborhoods, is that the fair housing law only allows 5 unrelated people. And so the representative is right. We need to expand that too, to allow more unrelated people in a home so we can provide these services.
Thank you, Sherry. And we have Hallie, and then we need to move on. So go for it, Haley.
So I just want to go off of what Caleb and Sherry, correct?
Yes.
We're speaking about. I just want to speak to you on just a person-to-person basis, Sherry, just to share with you that conflict of interest, whether you intended one or not, I have just went through this in my work life and was accused of conflict of interest and published in Spokane paper twice, in Seattle once, and was doing only stuff with good intention. So it's not about our intention. It's about politics and perception, even though that's not the direction we're working from. So I just want to share that with you. It's been really hard. So your forthrightness is beautiful, and I believe you, and I believe in you. But it might be something to evaluate only because I know that it can go sideways regardless of what your intention is. So just sharing that with you.
Thank you, Haley.
Thank you. Michael?
Yeah, Blake, I know we're at time.
Yeah.
And I know a lot of effort went into making this proposal. What we're not asking folks to do is write legislation, right? And there would need to be a lot of work. I think if Caleb talked about a two-step process, and this is our first one in, so thank you, team, for bringing it forward, Sherry for leading it. We'll go back and talk about it, but if the concepts are right, I think that's what we would vote on today. And if the team is comfortable moving it forward, if you want to send it back to the committee for more work, that's fine. But if the concept of the incentives and vouchers and such are worthy, then I would say vote on it. If it passes, then we'll take it under consideration for the state plan with your support. And so that's kind of where we are right now. It doesn't all have to be fleshed out into what those incentive payments look like or tax relief looks like and all that. I think there's a next step to be able to put some options together, but that's where I'm at with it. We did kind of lead off with or you brought forward the more complicated one maybe than, say, expanding residential services for pregnant women or something. But we want to get a sense from the committee whether this is worth pursuing, I guess. And we're probably at a time we need to take that vote and see where folks are at.
All right, Amber, real quick, if you don't mind.
Yeah, I just wanted to also say that, I know that accreditation factor is a touchy subject for some people, but it's also another one of the only ways that we can incentivize people to lease to recovery housing operators is to offer some sort of accreditation as it's insurance. Landlords aren't going to want to rent to an eel buddy. They want to know that people are being held to some sort of standard. And Malika, I wish I could remember that the other one that I thought of, and if you find it in your notes, please bring it forward. But I can't at this time. But I do think it's a very important thing that some sort of accreditation is required for us to bring to landlords. So that's why that's in there.
All right, thank you. So are we ready to vote? Michael, and our voting would be, our options would be to...
I think one option is to vote it through as a recommendation for the plan to be part of the plan. The other is to vote no, just the concept itself doesn't merit inclusion. And then the third option, I guess, would be to vote vote on the concept, but with some changes, but we'd have to identify what those changes are. So that's kind of the three options I could see at this point. It looks like the senator has her hand up as well.
I just wanted to make sure we knew the number that we need to pass this recommendation, because I've noticed people are going, leaving the meeting and joining the meeting. So just making sure that it is of the members present, not the members that are part of the committee.
Very good point.
Understood. Michelle?
Sure.
Yeah, would it be possible real quick to have every present committee member go ahead and raise your hand right now so I can just count who is here, and then we'll have that number. Perfect. Okay. Just going to wait a couple more seconds while folks get their hands up. Okay, looks like we have 20, and
Michelle, in all honesty here, my connectivity keeps going out, so I don't know if you counted me or not in that 20, but.
oh, okay, right. No, I see your number and I don't see a hand for you. So yeah, 21, it looks like.
Okay. Thank you, Senator. Appreciate that reminder. Let's go ahead then and go ahead and take our vote. So first option is to we'll say to accept the recommendation as is. Were there more questions? I'm sorry. Senator Braun.
Caleb had a question in the chat.
Okay.
Yeah.
Sorry, Caleb. Okay.
I want to be clear, is the first option to accept the concept with further refinement, or as is? You said as is. I don't think that's what you meant.
No, I think we've presented three options, Senator. It was 1 as is, 2 no, and then 3 yes with qualifications, right, or modifications. Is that correct, Michael?
Yeah, that's where it's going to be difficult. You know, in regular voting, we would amend the motion, right, to get through the voting process. So maybe we see how many are in that category of yes with some modifications.
All right, we'll take that
and
first.
at that point, we may need to figure out what those modifications look like. So, yeah.
Okay. Thank you. Thank you for the clarification. Thank you for asking that question. Do we have anybody else with their hands up? Sorry, I'm having to flip back and forth here. Anybody else have comments? Looks like we're good. Okay, well, let's take the third option as our first voting option. Is that if you're raising your hand at this point, you're voting to you're voting to accept the recommendation with qualifications, they say. Would that be an appropriate way to say that? So go ahead and raise your hand if you're in that line of thinking for this.
Okay. Right.
Any more? Michelle, we
Yeah, it
good?
looks like we've crossed critical mass on that one. I think we needed 13, and we're at 13 or 14 here.
Yeah.
And non-committee members, please refrain from voting.
So that's going to be the winner, right? I mean, we can't get to supermajority, and so it looks like the concept's a favor, but with some changes. Now the question is, how do you get changes in less than 10 minutes time? It sounds like this is something we're going to have the committee sort of solicit change ideas, I guess, from the members at large, and then rework it. Is that the best path forward?
Yeah, I think I can field questions and revisions from members in a follow-up email. So everyone has a copy of the recommendation right now. So before the next Recovery Support Services meeting, we can get some feedback from committee members about what changes they'd like to see or what clarifications they need.
Okay. Again, Blake, before you go forward, I just want to thank that group, Sherry and her team, for bringing this forward. This gives us an indication of how complex this process could be as well. If we end up seeing scores of recommendations coming through, this takes time, right? So thank you for your patience and thank you for your leadership bringing that forward. Blake.
Yeah, thanks, folks. So we need to get to public comment. Our hands raised for questions. Are we just still up? Any questions? Okay. let's go ahead and open things up for public comments, and we're ready to do that. So if you have a comment you'd like to make, please raise your hand. If you do not, then please lower your hand. Okay. Rep Lekanoff, would you like to make a comment?
I do, thank you. My comment goes back to the first discussion, talking about the wellness courts and the wellness program. I'd like to explore, know a little bit more about how this group plans to consult with the Washington tribes. As you know, the Washington tribes have developed wellness court programs. These wellness courts, some tribes have had a relationship with counties where non-natives are able to go into the wellness court and then provide and have their services conducted by the tribe. And the example I use is Skagit County and the Swinomish tribal relationship with their Dugualit Center, which is their recovery center there. I would love to be able to see maybe a presentation on how those courts are working, how the tribes and the counties and the state government are working to incorporate non-tribal members going into the tribal wellness courts, how the services are being provided, and what type of outcome that they're seeing based on the results of this process. As I believe there may be an opportunity here to explore that type of model being used through the state. So a friendly suggestion to this amazing committee, more to come.
Thank you very much. Lisa Doggart.
Good morning, everyone. 2 points quickly. One, I'm hoping that in future meetings that the public comment portion could actually be at the outset, and that would allow members of the public to comment on the action items that are actually before the committee, so that you don't take a vote and then receive comment that might have affected the way that some members would want to vote. I don't know that that happened today, but I think it could coming up for future meetings. Substantively, I just wanted to ask that HCA indicate how community members and experts can contribute materials to the conversation around criminal legal system policy, and what the research and evidence is with respect to what works for whom and what has unintended consequences for whom, or mostly unintended consequences. There's, many people who have devoted the last couple decades to achieving a deep and nuanced understanding of those questions. And I know many of us would like to share that with HCA. So I'm just hoping that reviewing the materials for today, I think that we're just scratching the surface of what is out there that could be really useful to share with the committee. So I'm just hoping that there can be a portal for those of us who work in this area to share other research and policy work that exists. Thank you.
Thank you. Vanessa Martin.
Good morning, committee members. I just want to elaborate on Malika Lamont's comments earlier in the beginning of this meeting, that the recommendations are missing the lead sites that are funded under Senate Bill 5380 and or COSAP funds. Also WASPIC's AJA programs funded under House Bill 1767. So I would hope that these will be included in the recommendations as they're continuing to be built out. And from Whatcom County, we launched LEAD through the prosecutor's office countywide, and we are seeing incredible success in our county through this program. And we were funded through Senate Bill 5380 and COSAP. And we are also expanding our program because of the success that we're having. So I hope that the committee includes these in the recommendations moving forward. Thank you.
Thank you. We'll leave the meeting open for more comment.
I would just like to invite Lisa to our outreach and engagement and diversion subcommittee, which I believe is this week, is tomorrow. I'd really like you to come. It'd be great.
All right, thank you. Looks like Brad Finegood.
Yeah, hi, thank you. I just want to really honor and raise what Caleb was talking about earlier around conflict of interest and making recommendations that where people have financial incentives. As an employee of King County, I'm required to sign off on a conflict of interest form prior to employment in every single year. And I think that that's really important for the integrity of this group and this committee. I'm not saying anything about the recommendation around recovery houses or anything of the such, because I very much understand the importance of a sustained recovery continuum throughout the community. But I was a little remiss to hear that whole conversation and then hear a vote, like basically, then hearing a vote taken once, yeah, anyway. I would think that that would be a really good idea moving forward, that groundwork be laid.
All right, thank you. Okay, Michelle, it looks like we have a couple minutes to wrap up. Don't see any other hands. Sorry about handing off to you late. 2 minutes. Thank you.
Yeah, so thank you so much, everybody. The wrap up and next steps that I have right now are that the committee has decided to not have an additional meeting to continue the discussion about the criminal legal response to controlled substances. So that will be continued at the monthly July SURSAC meeting. That there were no additional requests for information, although there has been raised that there's at least no direct request from HCA or from me about what information is needed or to provide, but there has been mentioned that there's a lot more research and studies, reports that would be helpful for the committee to have access to review, to formulate your views on the criminal legal response, as well as other questions that may come up in this work. And so we'll talk about a process for collecting that additional resources that committee members would like to share with one another, since you all have access to a lot of the information and reports of your own, as well as continuing to provide information where we can. And then finally, the conflict of interest issue has come up, so we will follow up around that as well and let you know what will happen around that. And I think that is that's all for wrap up and next steps. Any final comments?
I would like to make one. Sorry, I'm vocal today, more so than usual. But I would just like to say that Sherry's time and expertise is super important, and we're really lucky to have her as co-chair for the Recovery Support Services Committee. And I know that conflict of interest is something that we really want to watch out for, but I really want to say that her experience and her expertise are invaluable, and I'm just really grateful that we have her. And I want to thank her for her time and her service.
Thank you, Sherry. Michelle, we do have one question in the chat around.
Oh yes, Lisa. Yeah, can members of the public contribute? There are a lot of subject matter experts tracking this process who can share. Yeah, Lisa, that is. Oh yeah, is there a way to contribute materials to the criminal legal system policy resource pool? Yes, please. Yeah, we'd love to draw from the expertise of of the public, like subcommittee members, to share that. So I'll communicate once a plan is developed around the process for fielding and sharing that additional information.
Michelle, this is Michael. Just to be clear on that, then, because it's not a subcommittee, there'll be you'll send out with the minutes from this or a special note to this group and the guests here today on how to send in that information. Is that what you're saying?
Yeah, sorry, Michael. I was thinking subcommittees can as well, but yes, everyone that has attended the meeting today will be asked to contribute if they want to. Mm-hmm.
Okay, thank you.
Okay, thank you, folks. See you soon.
All right, thanks, everybody.
Thanks, Blake. Thanks, Michelle.